Hello, everyone. My name is James Phillips. Today, I'll be presenting an interesting case of scientific misconduct in a situation that involved three elderly women that lost their ability to see. The importance of highlighting this case is to show how an unproven therapy of intravitreal injection of autologous stem cells to treat AMD caused three elderly women aged 72 to 88 to lose their eyesight function. The key information was there were additional measures, such as vitamin treatments, that were proven effective treatments for AMD. Please take a moment to read the case topic from the New England Journal of Medicine. The methodology for the stem cell procedure was simple in its process. Step 1 was to inject the adipose fat-rich area to prepare the sample for retrieval. Step 2 was to draw out the adipose tissue solution that had been injected 15 to 20 minutes later to separate stem cells from adipose tissue. Additional steps were happening simultaneously while steps 1 and 2 were being performed. 35 ml of whole blood was drawn to establish a plasma product. A liposuction aspirate was processed to create a pellet of stromal vascular cells, which would be used in the intravitreal injections. The pelleted cells were resuspended into the plasma product, which was then used to immediately inject into both eyes of all three patients. Patient 1 suffered from anterior subluxation of the lens in both eyes, which was more prominent in the left eye. Macular thickening, as you see in the image, were noted. Also, if you look at Charlie, retinal detachment and adhesions in the left eye, while hemorrhages in both eyes were documented. Patient 2 and 3 experienced several of the same issues as patient 1. Statistical significance of the study shows, as we read the table left to right, a substantial increase of vision impairment or loss of eyesight altogether happens. Vision measurements start to move in the wrong direction or worsen to the point of not being able to evaluate by the end of the study. This entire case screams scientific misconduct. From the unproven methodology and lack of preclinical trials should have been a red flag. Unfortunately, the three women in this scenario suffered from the researchers' lack of proper protocol. The future of stem cell therapy will begin to establish more regulatory processes to understand the overall safety of the procedure of autologous stem cell therapy. As you see here from Ali in her quote, that the ethical and legal controversies have yet to be regulated. After the present case had such a devastating result, many other cases started to rise with intravitreal injections of stem cells causing blindness started happening all over the world. It was so bad it got the FDA's attention that made them issue a warning to cease. The fact that this study was presented in the clinicalgovtrial.com website without proper preclinical trials is a mystery, and concern for the research being conducted now. The afterthought of maybe we should have just tried one eye was bewilderment on my part.